Glad you're here today. We want to talk about viral weather on the Weather Network, and we've drawn together a group of really good people. Our chief meteorologist, Chris Scott, is here. We're going to talk about the summer that is coming. Mark Gibbas is part of a Weather Network company called Weather Source, and they're in Boston. And also Dr. Sumon Chakrabarti is with Trillium Health in Mississauga. We're all speaking to you remotely because of COVID-19. Let's go to Mark and talk about weather and what Weather Source does as an entity. You gather information about the weather, right?
Weather Source provides weather information throughout the world on every continent. Down to any latitude, longitude, so you can basically get weather information anywhere you want it. And what weather information do we have? Well, we have weather history, hour by hour, day by day, up to current time, and then continuing into the forecast. So it's a continuum of weather information over space and time. And this is really powerful for researchers if they want to understand how weather might be impacting the transmission of diseases or things like that. They can tap into our weather information for the locations of interest that they are studying and understand how weather might be playing a factor there. So it's a powerful data set for researchers. Of course, there's commercial applications too. But for this case, we're very excited about opening this up to researchers to try to understand, how this virus is spreading and maybe find some advantages that we can work with.
There have been some reports that have been written, Mark. Harvard University has had a study out. The World Health Organization has been using data. Is that the kind of data we're putting forth to people?
Yeah, precisely. So there's been a lot of studies, trying to understand how diseases in general are kind of helped spread by weather. But in this case, coronavirus, at least there's some evidence, and you can debate on how much evidence is it, but there seems to be at least some evidence that weather does play a role here.
Okay, I want to go to Dr. Sumon Chakrabarti, who's with Trillium Health in Mississauga, Ontario. You're actually working with COVID-19 patients today, Doctor. What's a little bit different about this particular strain as opposed to others?
Well, the big thing with this new COVID virus, the coronavirus strain, is that, listen, we have lots of coronaviruses around. We've all probably had one with the common cold, but this one looks to be quite contagious, as you're seeing it's spreading around the world, and it can cause severe disease, especially in individuals who are older or who have immune suppressing conditions. So this is something that you don't tend to see in the kind of more garden variety coronaviruses.
If we talk about some viruses of recent memory that have been, pandemic in nature, like H1N1 and SARS, and now this one, is there some differences between them?
I would say so. So, for example, H1N1, it spread very quickly around the globe as well. But there was a group of people, which interestingly was older people, who actually had some partial immunity to it. And that's part of the reason why it didn't, spread like wildfire, so to speak, even though it did spread quite broadly. Coronavirus, the initial one, SARS, in 2003, it spread, but it couldn't spread as efficiently. And it was very, very severe. So it would kind of get to somebody, it would be very severe, would often kill that person, but then it couldn't spread. The problem with this current coronavirus is that it spreads quickly, it spreads efficiently, and yes, it does kill a minority of people, but it's able to do it so to a point that the transmission chain continues over several weeks, and that's what we're seeing right now. And that's the difference with it compared to other ones.
In our next segment, I want to get into some fallacies that have been spread about this, but right off the top, I want to ask a couple questions about the actual virus itself. How long can it live on a surface?
That's a question that we're learning more about every day. So it can live. It depends on what the surface is. You can see, for a couple of hours on things like plastic and metal, and cardboard. It's been described as a couple of days. It can be there, but that doesn't mean that if there's virus there, it doesn't necessarily mean that if you touch it, you're necessarily going to get infected. We also have to remember that the virus, once it's outside of the body, it does rapidly begin to decline in its number. This is part of the reason why things like washing your hands and not touching your mouth and nose are so important.
The rapid spread of this in large populations, though, And we're going to talk more about the weather in just a minute. But is it winter weather that helped facilitate this in Wuhan initially?
Well, I think the best answer to that is possibly. So whatever happens with the virus in its spread is very likely multifactorial. In Wuhan, population density for sure made a difference. And the things with weather, it can indirectly make a difference because there's more people inside. But there's also, we do see with other respiratory viruses that certainly when the warmer weather comes around, we don't see it as much. Is that because people are outside? Maybe. Is it because that the humidity can affect how far the droplets go? Maybe. And we'll see. It's coming up, but hopefully the warm weather comes soon. You guys will help with that.
Okay, well, there are a series of factors that are very interesting to talk about, but there's also a lot of social things that we do as individuals. We'll get to all of that in our next segment. If you're watching this on the podcast or on the weathernetwork.com, this, of course, will continue. We're going to take a break and get you updated on your local weather, and then we'll be back with our experts on viral weather. You're watching Viral Weather on the Weather Network. We're all connected remotely. The CEO of Weather Source, Mark Gibbas, is with us. We're also going to catch up with our chief meteorologist, Chris Scott, who is in Oakville, Ontario, and Dr. Sumon Chakrabarti, who I was talking to just a minute with Trillium Health in Mississauga. Let's just talk about survivability of viruses and what happens with the common cold and the flu when we move out of winter and into the warmer months. Doctor?
It's a great question. And again, I think it does have a multiple factors. But, one of the biggest things is that we are no longer, cooped up inside. So, you have less of a more than 2 meter distance of people being separated. So that helps quite a bit. I do think there's also some effect on droplets and how far they can travel when it's more humid outside. We have to remember one thing. So, for example, influenza, we see these spikes during the winter months, but in the tropics, influenza actually is transmitted year round. So it's more of like a smooth transmission, whereas here in the temperate regions, more of these spikes. So it's still there, it's just not there as much, possibly due to humidity and also physical distancing.
So, Mark, outside of Boston, how many people are using the data that you collect on what the weather has been climatologically in the past and what the future is likely to be? How many studies are going on medically on this now?
Yeah, right now, we opened up our weather API to any researchers who were going to be studying coronavirus and wanted to try to understand how weather plays a role. We opened that up about a week ago. Right now, we have a couple dozen research groups using that information right now. And we're happy to do that. If there's anything they can glean out of it to kind of help combat this, then we're all for it.
And the data that you have is everything. It has to do with the relative humidity, the temperature, everything that they could possibly need to know about what the conditions are day in, day out.
Yeah, completely. The weather information is very rich, very detailed. Any variations in weather from hot to cold to humid to dry, all of that is captured in there. It's not just kind of an average of the weather. You kind of lose a lot of detail that way. So by having access to information down to the hourly level, if they want it, we're hoping that they can find some way of understanding this better.
Yeah, the more we mine data, the better. Let's go to our chief meteorologist, Chris Scott. Chris, let's talk about what our forecasters are thinking for the next 6 months here in Canada.
Well, the spring, obviously, Chris, as you know, it's a roller coaster in Canada. It's the season of ups and downs. As we get into summer, Dr. Doug and the forecast team are thinking that most of the country will be at or above normal in terms of temperature. But there's a big but to that, because in the context of the conversation we're having today, there's really two big points you've heard so far. Dr. Chakrabarti said, what's the impact of weather on the coronavirus? Well, it's possible there's an impact. We don't know the exact correlations. What Mark Gibbas of Weather Source has been talking about is that we are giving all of this granular weather and climate data to researchers who input that into their models. So this is really an interdisciplinary effort to better understand what's happening. This is a new virus. We don't know all the details of it. So we don't want to give people the impression that, if you're going to be above or below normal, somehow that's going to make a difference. We just don't know that yet. We are hoping, though. I mean, as the doctor said, let's hope that warm weather does change the transmission pattern of the virus.
And that's really interesting. And doctor, because we know that, as you had said, in more tropical climates, the flu doesn't go away. And as we go to our warmer season here in North America, the southern hemisphere is going to its colder season, which is conducive for this virus.
That's right, and that's a concern that I've seen raised, that if there is an effect from the weather, then what's going to happen in the southern hemisphere? I will say one thing: we have seen coronavirus, the novel coronavirus, in warmer climates, such as in Africa. We've seen it in parts of Asia, and it does look like, a lot of those places it hasn't taken off in other, as we have seen in, for example, in Italy and in the U.S. But again, just like you mentioned, we're still gathering all the data, and we're not going to have a good answer for this until we kind of pass the outbreak and looking back.
I just want to go to Chris Scott one more time. So the thing is, we're thinking slightly above average temperatures, and I know that the President of the United States said he couldn't wait for the warm weather because that would help. But these are things that people have no idea about, right?
Well, and I understand at this time, and I think we have a unique perspective, Chris, as providers of weather information, because weather is inherently uncertain. We talk about what we do know and help make decisions for people, help people make those decisions for themselves. But then we talk about what we don't know. And the unfortunate thing with the situation we're in now with SARS-CoV-2, the virus itself, we don't know a lot about it. And that's the great part about what Weather Source is doing, is providing the information. We're going to learn a lot more about it. And the idea of the weather, well, weather impacts everything we do. What we do at the Weather Network and our Weather Source is part of that, is we're harnessing the value of that weather and the predictions we can make. But we're very early on in figuring out those links.
Okay, more in just a minute. You're watching Viral Weather on the Weather Network on all our platforms, and it's terrific to have you with us. Mark Gibbas, who is the CEO of Weather Network Company, is going to join us in a couple of minutes. Also, Dr. Sumon Chakrabarti from Trillium Health Service in Mississauga, and our chief meteorologist, Chris Scott, is here. We were talking about the arrival of warmer weather, and that always buoys us when it comes, but it may or may not be a good thing.
Well, we're talking about the science behind how the weather may impact the coronavirus. But here's what we do know about warm weather. We do know that it generally has a very positive effect on our psyches. We're all looking forward to spring. I think most Canadians, especially, we endure a harsh winter, even though this one wasn't that bad for most. But we know that as we get into late April and especially May, everyone gets that exhale of gorgeous weather, temperatures in the teens. And regardless of the impact that has on the physical nature of what's going to be happening in our world, we know that in our minds, that has a huge lift and can help buoy us. I think that's something to look forward to. And that's different from the physical science of the virus and the biological science. But there's something in our brains that is very optimistic as we get into those times.
Well, I think it's that whole survivability thing. I mean, as a species, we know that spring is the time that we reproduce, and that's when the plants start all of that. And so it's human nature to get a better mental feeling, which is actually probably going to be a real positive for everybody. Doctor, let's talk about the warmer weather. And we were discussing the other day when you and I spoke about, we track the spread of this with colder temperatures. The optimum temperature for this virus, COVID-19, to survive is between about 4 Celsius and 15 Celsius, right?
Yeah, I've seen, again, some data on that, but it's a work in progress still in terms of the exact temperature.
How do you feel about the warmer weather, other than the fact that we all enjoy it?
Yeah, well, I can't say how much I enjoy it because I love it. But yeah, I mean, there's a couple of things to think about, because one thing is for sure, we do see an effect on respiratory viruses. They tend to reduce in the springtime. We have to be wary of another thing, though, is that if there's going to be a temptation of people to want to be outside, and at that point in time, physical distancing is still in effect, we want to remind people that it's okay to be outside, but stay close to your residence and be with the people in your family, as opposed to congregating in groups, because it's still going to be important, even when the weather is warm, depending on what the outbreak is doing, for us to maintain that social distancing until we see signs that we can pull back on that.
The most important things then, again, just to go back to the virus and our day-to-day lives now, are our hygiene and the distance, right?
That's absolutely right. So from the individual level, we want to continue to meticulously wash your hands, avoid touching your mouth and nose. If you're feeling unwell, don't go into public. And we talked about all those social isolation measures of people coming back from travel. And right now we're in the phase where we're doing the massive physical distancing as well, trying as much as you can to avoid being close to other individuals. And this helps overall to break the transmission chain. We're in that phase right now. It's not going to last forever, but it's important to continue that for the time being until we see what results we get from that.
So social distancing is with us for a while, isn't it?
I would say definitely for the next month and a half at least. But I'm hoping in the next 1 to 2 weeks, we start to see the effect of so-called flattening the curve, seeing that the cases, they start to slow down a bit and spread out. That's what the goal is.
I've heard talk that there could be another wave. Tell me how that kind of manifests itself. They say that, we may flatten the curve, but we'll see it come back up again in 4 or 5 or 6 months.
That's right. And one of the concerns is, okay, you do all this social distancing. As soon as you release it, then you get another wave upcoming in the fall time. That is something that's definitely people are looking at closely. And it's important that once the measures are starting to be released, there's other ongoing surveillance, and we call it the hammer and the dance. You bring down the outbreak. Once it's at a low level, we now try to keep it at a low level as best we can with relaxing measures, ongoing surveillance, and then eventually, hopefully, we see a vaccine. And I'm wondering at the end of the year.
Well, and that's the thing about vaccines. A lot of people say, well, we'll get a vaccine for this, but it takes a long time to grow a vaccine.
That's right. The research, vaccines are not simple, and the research is quite complicated. There are trials going on right now, but I don't expect to see anything until at least the end of 2020. But I do think something is in the pipeline for this.
How many patients are you seeing right now?
Well, right now, across the city of Toronto, we're getting a smattering of patients. We're seeing, a couple here in the hospital. It's not anything like Italy. And the problem is that we want to be able to avoid that, which is why physical distancing is so important. So right now, it's the occasional, but we're awaiting a large number of increasing in the next couple of weeks.
We're talking on the Weather Network about viral weather with Dr. Sumon Chakrabarti in Mississauga. Our chief meteorologist, Chris Scott, is with us. And the CEO of Weather Source, a weather network company based in Massachusetts, Mark Gibbas, is with us. And we're going to talk to Mark in our next segment about optimum temperatures and some other reasons why this is transmitted so easily. But let's break for your local weather on television now. The podcast will continue. We're having a conversation about viral weather on the Weather Network, and it's an extended podcast. You can also catch it on our website, theweathernetwork.com. We've been talking with Dr. Sumon Chakrabarti, our chief meteorologist, Chris Scott, and Mark Gibbas from Weather Source, a weather network company in Massachusetts, joins us. Let's talk about, the start of this virus began in Wuhan province and then spread towards China and northern Italy. And there's a lot of reasons why, and it has to do with the weather, but other things too, right?
Yeah, absolutely. Weather affects, so many things that humans are doing. It really dictates where we live in the world, if you want to look at it that way. Why would this virus, want to spread when the temperatures are, in the, like 5 to 10 degrees Celsius range? I think a big reason for that is, in the Northern Hemisphere, that's where people live. We're not living where it's negative 30 degrees C. So when you have these population centers like in Wuhan province, yes, it's cold, but it's also a populous place. So, though that's kind of a perfect condition, right? It's warm enough for people to be there, but cold enough such that the large population centers are, thriving. And then another piece of this that maybe needs to be studied more is when you take cold air and bring it inside and warm it up, it lowers the humidity of that air. It makes that air a lot drier. You'll notice, on a cold day when you warm the air on inside your house, everything gets staticky, and that's because there's a lack of moisture in the air. And they're finding out that maybe this lack of moisture might have a play as well. So there's lots of reasons. Weather and human behavior kind of go hand in hand, and I think that kind of plays a lot with how this virus is transmitted.
Well, I mean, when you look at the weather conditions in December, January, they were optimum for this virus in China. But then as we moved a little further along into January, February, the conditions through Iran and that part of Western Asia became optimum. But there's also the human factor that we all behave differently in different environments. I mean, in Italy, people kiss on each cheek when they meet, right?
There's that too. There's social customs that come into play that are definitely part of this, I believe. The other thing too that comes to mind, and I think the doctor mentioned this earlier, is that there was a lot of travel out of Wuhan province, and specifically a lot of travel from Wuhan province to Italy and Iran. So that's a piece of this too. And of course, those locations, Italy and Iran, also have temperatures that seem to be conducive for this.
When we start looking at like where the greatest transmission is in Europe, and again, this folds back to the temperatures being at the ideal for the virus to sustain itself. When you start looking at Switzerland and Germany and France and Spain, their temperatures were those, and now that's evolved as you go further to the north through the Netherlands and Belgium and into the United Kingdom. Again, their temperatures are all at this sweet spot.
Yeah, correct for now. Right now the temperatures are in the low degrees Celsius above zero, 5 degrees Celsius up to 10 degrees, 15 degrees Celsius. So, it still seems to be in that range where the virus, is more conducive to spreading for a variety of reasons. I guess we're still trying to figure out. But it's only going to last that way for a little while longer. The Northern Hemisphere will start to warm up. I know that we're hearing plenty of advice that, well, just because the temperatures are going to warm up, don't be looking for a sudden vanishing of the coronavirus. And I think we all get that. But I think we're also looking for any help we can get, right? So, if it does turn out that something about the warming temperatures and the human response and how we're socializing or how our bodies are responding, if any of that can push us in a better direction, I think we'd be all for it.
I think that you're right. Doctor, H1N1 was because we thought it would go away in summertime, but it didn't, right? So this kind of throws water on some of those theories.
Yes, well, that is actually one of the theories. So H1N1, the pandemic, as we call it, PH1N1, what that does now, that's now part of the seasonal circulating viruses that we see. So it kind of the pandemic was gone, but now it comes back in waves every year. And that's one of the possibilities with coronavirus. It may become part of that viral milieu, but after its waves, it's not going to end up being like this. We're all going to have, many of us will have immunity to it, so it won't be able to spread as quickly as it is doing right now.
So everybody who comes in contact with this, they don't all get sick, right?
That's right. Up to 80 to maybe even 85% of people have a very mild type of course. And we're talking like, a little bit of sore throat. There may even be people that have not really any symptoms at all. But you have to remember, which is why physical distancing is so important, because even if you have minimal symptoms, you're able to spread it to other people.
Okay, so again, wash your hands, social distancing, self-isolation is absolutely critical. And at this point in Canada, we're saying, even if you've traveled out of the province, you've got to self-isolate. We're having a terrific conversation about viral weather with Mark Gibbas, our chief meteorologist, Chris Scott, Dr. Sumon Chakrabarti, and of course, we'll get to that in a second, but on the Weather Network on television, we want to break for your local forecast. Thanks for being with us on the Weather Network. I hope you're enjoying this podcast at theweathernetwork.com and on the Weather Network on television. Viral weather. We're talking about COVID-19, its impacts, how the weather may play into this. Mark Gibbas, the CEO of Weather Source, a weather network company in Massachusetts, is with us. Dr. Sumon Chakrabarti, who is a doctor of infectious diseases with Trillium Health in Mississauga, and our chief meteorologist, Chris Scott, is here. We're talking about humidity and the Mark, you had a really Chris, you had a really interesting thought about this, about relative humidity and vaporizers in our homes.
Yeah, I just wanted to pick up on something Mark Gibbas said, because it's an important part of science, how if you take a given unit of air and with an amount of moisture in it, and then you warm that up, the relative humidity drops quite a bit. And that's why in the wintertime, in the absence of having a humidifier on your home furnace, the air inside gets very, very dry. And my question for the doctor was, what does the science say? What does the immunology say about having more water vapor in the air in your home? Does that help at all with lessening viral transmission?
It's a very interesting question, actually. So for the humidity, in general, we know that it does have health effects when you have really, really dry air. And one of the biggest things that comes to mind is, especially in children, is nosebleeds. When you have really dry air, and any type of thing where you have compromising of your mucosal membranes, that can be the first line of defense that's being compromised. So I think that in general, it's a good thing. It helps with things like asthma and those conditions. So whether it has a direct effect on the viral transmission, I don't know, but I don't think it could hurt. So I think that keeping a vaporizer or a humidifier in the winter months would be helpful overall.
It's interesting because we think about as we go to the warmer months here, people are going to start using air conditioning more too, and that's actually going to bring down the relative humidity in their houses. So, is that going to be good? Are we going to use less air?
Yeah, and there are some infections, not coronavirus, but other infections that we know can sometimes be associated with air conditioners. But one thing I've seen this around social media a lot, people worrying about this happening with coronavirus. There's no evidence for that. And usually the infections we see with air conditioners is when the air conditioner is really old and decrepit and hasn't been cleaned in a long time. So, I'm still hoping that we'll see some type of positive effect with the weather. But it's hard to know exactly how big that effect will be.
Doctor, this question maybe hasn't not been asked properly. Where did this virus come from? I mean, how did it wound up in us? But where did it come from?
Well, when you look at things like the influenzas, the thing in China is that obviously we know there's a very dense population there, and there's a really high number of livestock in close proximity, cows, chickens, pigs. What we do see with certain viruses is they can kind of bounce back and forth between animal and human just from being in close proximity. You can have different types of mutations, and over time, you can occasionally get new viruses. And we saw that with pandemic H1N1 for influenza. And this is the theory with this novel coronavirus. It was something that came from a certain animal and then mutated in the human back and forth. And then we saw this virus that was able to spread very quickly and had the ability to be fatal.
So it was initially called novel coronavirus, and then 19. So explain just why it's called those three things.
Yeah, it confuses me a little bit too. So initially it was novel coronavirus. The official name of the virus is SARS coronavirus or SARS-CoV-2, which is the second one. And the name for the disease that it causes is coronavirus disease 2019 or COVID-19.
Okay. And with this virus, so we've never seen this type of virus before. It's brand new.
That's right. Well, we've seen coronaviruses. We've all here in this chat have probably had one with the common cold. That's a coronavirus. But this is a novel or a new coronavirus that has different properties, as we can obviously see.
So how many new viruses like this come along?
Well, I mean, it happens quite often, and with influenza, that's one of the most common ones where we see different strains of influenza coming out every, 20 to 30 years. But these type of viruses probably do come out all the time, but they don't necessarily, go beyond the initial epicenter. But occasionally, we see these pandemics, and with world travel, we're going to be seeing probably more of these, unfortunately. Not necessarily respiratory, but you guys heard of chikungunya and Zika that happened recently as well. So we'll be seeing more of these in the coming years.
Well, that's a concern, and it's when we talk about climate change and global warming, the opportunity is there for more viruses, right?
Definitely. And you have the opportunity of introducing viruses into different climates where they could have a different effect. And that's why it's important that, we have a good surveillance system to be able to pick this up and react to it quickly. And that's what I think, at least in Canada's situation, that it's something we did. We enacted these social distancing implementations, hopefully early enough that it'll have a good effect.
Okay. We're having a talk about viral weather, how COVID-19 is having an impact on all of us. We have our experts gathered. We have another segment to come here on the Weather Network on television. Of course, our podcast continues too. We'll take a short break right now for an update on your local weather, and then we'll get back to this talk. Viral weather, we're having a conversation about coronavirus 19. And when we last left off, we were talking a little bit about climate change. Chris Scott is our lead meteorologist. Chris, let's talk quickly about how climate change may have an impact in the future on viruses.
Yeah, and anytime, Chris, as you know, we talk about climate change, we're talking about risk and changing risks. We can never talk about climate change as leading or causing a single event. And in the context of this novel coronavirus, there's no evidence to suggest that climate change either exacerbated or mitigated the situation. But going forward, I think the doctor would attest to the fact that we're going to expose ourselves to different risks as we see climates changing around the world. Doctor, what have you seen on that in terms of research?
I completely agree with that, and there is an intimate relationship between, certain types of climates and certain types of infectious diseases. One thing, for example, in areas that are warming up, you're starting to see diseases in places that may not have been there before. So, for example, right here in Canada, we're seeing, Lyme disease. The actual tick is now moving into areas that we haven't seen it previously. So that's just one of many examples that I could give. But you're right, there's a relationship, and we have to monitor for those increases in risk.
And Mark, I mean, your thoughts on the changing climate and this new risk?
Well, climate change is underway, right? I mean, we're living through it right now. We're seeing a lot of change around the planet. What's happening is, the weather and climate is now different in different locations. That's introducing new types of abilities for viruses to transmit. If a virus has a predisposition for certain types of weather patterns and weather conditions, climate change could help make that more viable, right? So we're kind of living through it right now. It's already underway. We're seeing, threats not only on more physical sides of sea level rise and wildfires raging all over the place, but also the ability to transmit these diseases more readily. And of course, we're also living in a very globalized world, which is adding that factor to it too. So climate is changing, and we're moving around more than we ever have.
Mark, last thoughts on the data that you have at Weather, what you want people to know about this data that
Sure. Yeah. Thank you for that. As you know, we've spoken about it a little bit already, but WeatherSource has a tremendous database of weather information globally for any location on the planet, and we have time series of information, on all weather variables, hour by hour and day by day from the year 2000 up to current time. So it's a very rich data set, and we've opened that up to researchers who are studying COVID-19 and the coronavirus. We want them to have free access to that, to be able to find whatever relationships they can find that would help benefit everyone, to help hopefully get over this. So we're excited about it. I know that there are a couple dozen research groups, using our data today to try to find linkages and try to find ways of battling this. One thing that I'm hoping that they're looking into is, if there is an optimum temperature and humidity for our homes as we're moving into summer, if there's a combination of temperature and humidity which makes it harder to transmit this, then let's figure that out and let's everyone set our thermostats and everything to the right level. I think that's an important question that needs to be looked into.
Okay, and the good doctor, the most important thoughts that you can pass along here in closing.
So in closing, I think that we're all hopeful that we might see a difference with the weather, but right now the most important things on the individual level: continue to wash your hands, avoid touching your mouth and nose, stay out of public if you're feeling ill. But in general, we're seeing that anyway with the physical distancing. It's the most important thing we can do right now. If you're going to go outside, stay close to your home, avoid gatherings of more than basically 2 people apart from your family, your direct family. And, we really have to keep this going over the next several weeks if we're going to see a impact. And I'm optimistic that we will. I think we put it in time, and we just have to work as a team.
Okay, we'll be continuing to check in with you over the next couple of weeks. And Chris, with you, with a minute left, I mean, your thoughts on this as your final thoughts?
Well, just to emphasize what both the doctor and Mark said. So first of all, this is about listening to public health officials, medical experts. That's what we have to work with right now. The science, though, is going to come along faster than it's ever come along before. We're learning more and more quickly in this age of data science versus 11 years ago with H1N1. We're going to understand how the weather may be impacting this. We're learning in real time about this virus. So the number one point, listen to public health officials, but the science will catch up quickly and help us better fight what's going on.
Absolutely. Thanks a million, Chris, and I hope to see you really soon in person. The social distancing is absolutely critical with this particular virus, and so is hygiene, but listening to truth and science, as Chris Scott underscored so succinctly at the end there, truth and science. That's what you need to listen to. This is Viral Weather on the Weather Network. Hope you enjoyed it. We'll get to your local forecast on television. More podcasts are coming from the Weather Network.